Hi, this is Kathy Mulcahy again. I'm making a second video, and this is just a basic anatomy of a nursing exam question and how to answer them, some tips for getting through your multiple choice questions. Now, alternate item type questions like select all that apply, or fill in the blank, or drag and drop, or ordering, or just kind of completely separate entities that I'm going to cover in subsequent videos. But for now, just kind of pay attention to what I'm giving you here. Okay, so now it's time to dissect typical nursing exam question. This one's a multiple choice. Everything I'm giving you today will be on multiple choice questions. Select all that apply are the trickiest ones, and they're kind of a special case. Okay, so the scenario and question itself, which are here in the top, are known as the stem. Most nursing test items will make the stem consist of two parts. There's a scenario, and then there's the actual question. So you need to read every word of this very carefully, because the scenario, and I'll bracket that one off here, the nurse is caring for a patient who complains of dyspnea. The pulse ox reveals that the patient's oxygen is 89% on room air. That's your scenario. You need to understand what's going on in that scenario to answer the actual question, which is what should the nurse do first? When you're reading the stem, keep an eye out for strategic phrases like best, most appropriate, priority, first, initial, immediate, most likely, early signs, late signs. All those little things can change. All those little words can change the context. Also things like need for further teaching. They can change the context of your question. So you need to read every single word. By the way, NCLEX and most instructors do not maybe bold print those words. Some NCLEX guides will. But don't expect them to be bolded or italicized or anything like that. You need to learn to read them, okay? By the way, if your understanding of medical terminology isn't your best strength, you should get a book on medical terminology and review it. Sometimes the words in your PowerPoint are a little different than what you see on the exam. For example, your instructor might put the phrase inadequate urinary output on a PowerPoint, but the question is asking you which of the following indicates oliguria? Well, oliguria is the same as inadequate urinary output, but if you don't know your medical terminology, you won't get that one right. So common prefixes and suffixes, I don't have time to cover them all, but you should definitely have an understanding so that you can decode some of those words. In this case, let me highlight something. We have the word dyspnea. Now maybe your instructor used the phrase shortness of breath, or difficulty breathing, or they might have abbreviated it SOB, and you've never seen the word dyspnea before. But if you know that DYS means difficult, and you know that the suffix PNEA always means something about breathing, like tachypnea or bradypnea, then you know that dyspnea is the same thing as difficulty breathing, is the same thing as shortness of breath. So definitely brush up on medical terminology if that's something that you need to do. Okay, so in this case, we have the word first, and that kind of tips us off. We have the situation. The nurse is caring for a patient who complains of dyspnea. We know that's shortness of breath. Put him on a pulse ox, reveals that the patient's oxygen saturation is 89% on room air. Now, just a few more words about reading the stem. Don't read into the stem. The stem gives you all the information you need and no more. For example, in this question, we don't know the patient's diagnosis. We don't know if he has COPD or if he has CHF. We don't know any of that. We don't know if he's got antibiotics infusing, so you can't infer an allergic reaction. All we know is that he's short of breath and he's showing signs of hypoxia on the pulse ox. That's all you need to know. There's nothing about choking. There's nothing about aspiration. So don't read into the question. Answer based solely on the information you have. And remember that the world of nursing exams is sort of an ideal world. You always have the equipment, the staffing, and the orders you need to do your job. You're never going to be asked to do something outside your scope of practice. Don't try to base your answer on some unusual experience that you observed maybe on the job or with a family member or on a clinical site. These things might not have reflected the ideal world of NCLEX and nursing exams. They might not be best practices or current practices. So try to, get those unusual situations out of your head. Maybe you work on a floor where the tech is asked to do things that really aren't in their scope of practice, or the nurse does things, or you're in a specialty unit where the nurse has a bigger scope of practice. Ignore that. You are now in the fictionalized, idealized world of nursing exams. So stay there. Read the question, read the STEM completely, and answer based only on the information you're given. So, the answers, again, are known as, I don't know if I just said this or not, options. Whoops, let me get a better color for that. Okay. Again, the most important thing you can do is to read every word. Make sure that you read all of the options. Remember, in nursing exams, sometimes more than one option is actually correct. But one is the best, or one is the first, or one is the most likely, or one is the most appropriate. Another option could be appropriate, but not as appropriate. So you're looking for the best answer, which means you have to read them all. Okay? In other situations, your question might actually be like a negative phrasing, like when they ask for, which indicates the need for further teaching. And 3 answers are good things for the patient to say that indicate that they understand, and 1 answer is incorrect. That means the patient needs further teaching. So keep in mind, little things like that. Make sure you understand what the question is asking you, and then go to the options. Read each one individually carefully. Once you've read the options carefully, if you don't know what the answer is at that point, use the process of elimination. If it's a multiple choice question, a lot of times you can eliminate 2 answers because they're just blatantly incorrect. So, anything that is outside your scope of practice, anything that, you're not going to place a chest tube in this patient, for example. Anything that would be inappropriate or unsafe. You need to really just rule those out immediately. A lot of times that'll leave you with 2. And evaluate those remaining options carefully. Anything that says never or always is typically wrong. Again, your mileage may vary, but almost always when you see a never phrasing or an always phrasing, try to avoid that. Avoid any options that are medically oriented, not within your scope of practice. Okay, so let's look at these options that we have here. I'm going to shrink the stem. And let me see if, I'm going to have to do this. Okay, so in the preceding stem, we had a patient who was short of breath, desatting. What does the nurse do first? Now, start with contact the provider immediately. Contacting the provider immediately is seldom your best option. In this case, there's definitely at least one nursing measure that you could implement before you call them. So, although in some circumstances there is nothing you can do within your scope of practice, if there is something you can do for this patient first, that would be the best response. So it might be necessary to give SBAR at some point for this patient, and maybe even soon, but let's think about what the nurse can do before we get on the phone with that provider. Okay, let's look at choice B. Administer oxygen, via nasal cannula at 2 liters per minute. Okay, so in an emergency, this is within your scope of practice, but is this your first intervention? Think critically here. Oxygen's like a medication. It can have side effects and adverse effects. You still might have to use it, but is there something you could do first that involves less risk to the patient and maybe helps even that oxygen work better if you need it? So let's go to option C. Position the patient at a 90-degree angle. Raise the head of the bed to 90 degrees. This is also known as high Fowler's. So if you see that on a test, just know it's, 6 of one, half dozen of the other. This option lowers the diaphragm, allowing for better chest expansion. Raising the head of the bed decreases the work of breathing and results in improved ventilation. It also increases the effectiveness of other interventions that target oxygenation. So that might be a really good option. So let's keep reading and see if there's anything that trumps that. And the last option here is to encourage the patient to take deep breaths. So that's also appropriate. We want to increase ventilation and maybe make more oxygen available to that patient, but it's going to be a lot harder for the patient who's laying flat or laying in low Fowlers to get a good deep breath. They have to work against gravity and they have a tougher time getting air to move. So it's an appropriate intervention, but not your first intervention. Remember, go back to the stem. What should the nurse do first? So the correct option in this question is C. I'm going to highlight it. And it was probably a pretty easy question for you. But just going through it, a little bit at a time can be somewhat helpful for you to understand how questions work. Okay, so let's try one more. In this STEM, nurse is caring for a patient with diarrhea. Monitoring for which complication of diarrhea is the nurse's highest priority. Okay, so let's pick out those key words and phrases, okay? Which complication is the nurse, hold on. Let's see. The nurse's highest priority right here. That is what the question is asking you. So that indicates that maybe more than one option could be correct here. Let's go through our options and see how we do. Okay, so looking at the options, we have dehydration, skin excoriation, urinary incontinence, and malnutrition. Well, out of those choices, we could eliminate a few. For example, urinary incontinence is not, a complication of diarrhea. I would say that would be something you could rule out pretty easily. Now, looking at the other choices, we can't rule out dehydration because that can happen with diarrhea. We can't rule out skin excoriation because that does also happen sometimes when you have frequent liquid bowel movements. But malnutrition, there is nothing in this stem that suggests the patient is nauseous, vomiting, having food aversions, or loss of appetite. Simply diarrhea, that's all he has, or she. So we can rule out malnutrition. That leaves us with these two. Now, when faced with two answers that are correct, you want to know which one is the highest priority, you can use Maslow's hierarchy of human needs. And that will tell you basically, and even within the hierarchy, there's a hierarchy. So airway, breathing, circulation always comes first. Then you look at things like fluids and electrolytes because they regulate so many different functions in the body and they can lead to serious complications. And then we might look at things like risk for infection and, rest and sleep and nutrition and all of that. But out of these two, the most critical problem, the most immediate problem that we're dealing with is dehydration. Okay? Dehydration can be life-threatening. Skin excoriation can be uncomfortable. So that is how you would answer that question. So your takeaway points for this little video are, number one, read every word, stem first, and then each and every option. Don't skip over anything. Number two, use only what you've read, only the information you're given. Don't add information, don't read into the question, don't ask yourself, but what if it's never going to help you? 3, look for strategic words and phrases. Remember, first, best, most likely, most appropriate, early, late, initial, immediate. Look for those keywords. They're going to help you provide some context for the answer you choose. Number 4, eliminate anything obviously wrong, unsafe, or outside your scope of practice. Anything that just doesn't apply to the question. Just get rid of it. 5, if you're having trouble between two options, use Maslow's hierarchy to determine priority nursing interventions, or you can even play a little game like what's the worst case scenario, and pick the one that's going to keep your patient the safest. And number 6, this is my last piece of advice. If you have read the stem and the options carefully, and you've read every word, and you've taken your best guess, do not change your answer. This is a golden rule of test taking. If you study the content and you read and understood the stem and you reviewed your options carefully, your first answer is most likely to be correct, even if you guessed. Only change answers if you reread the question and realize that you skipped something major. Maybe you didn't see that keyword, or maybe, you were too quick to pick something. Otherwise, leave it alone. All right, that's it for part 2. See you in the next one.